Hello. My name is Dr. Francois Ricard. I am an osteopath and a PhD. I am director of the International Madrid School of Osteopathy, EOM, and president of the Scientific European Federation of Osteopaths, SCFO. In this video, I want to talk to you about the effects of spinal manipulation for the sympathetic and visceral systems. This series of videos will look at the scientific literature surrounding the mechanisms of spinal manipulations, mostly used by osteopaths and chiropractors. In these videos, we will study the mechanical mechanisms of action for disc hernias, and the effects they have on the peripheral and central nervous systems, the neuromuscular, biological systems, and so. In this video, we are reviewing the neurophysiological effects of spinal manipulation, in neurovegetative systems, and on the organs. Bolton and Budgell, 2012. Attribute the visceral effects of spine manipulations to somatoautonomic reflexes. According to Kovanur et al., 2017, osteopathic manipulation induced a faster recovery of heart rate and sympatho-vagal balance after an acute mental stressor, by substantially dampening parasympathetic withdrawal and sympathetic prevalence. Ogura et al., 2011, examined regional cerebral metabolism using positron emission tomography, PET, and observed increased glucose metabolism in the inferior prefrontal cortex, anterior cingulated cortex, and middle temporal gyrus, after a spinal manipulation, and decreased glucose metabolism was found in the cerebellovermis and visual association cortex, in the treatment condition. The results of this study suggest that HVT affects regional cerebral glucose metabolism, related to sympathetic relaxation, and pain reduction. According to Kingston et al., 2014, all studies demonstrated a consistent increase in sympathetic outcome measures, indicative of sympathetic excitation, irrespective of the segments mobilized. The evidence of this systematic review supports a sympatho-excitatory response to spinal mobilizations irrespective of the segment mobilized. In the study by Sparks et al., 2017, imaging revealed significant group differences, with those individuals in the manipulation group exhibiting increased areas of activation post-manipulation in the insular and somatosensory cortices. This study provides preliminary evidence suggesting cortical responses in patients with non-traumatic neck pain may vary between thoracic manual therapy and a sham comparator. In these functional images, by Sparks, 2017, we can see on the left the group average areas of activation based on blood oxygen levels, which meet the zygapophysial threshold, responding to noxious stimuli applied to the cuticle of the index finger, A, pre-HVT, and B, post-HVT, and to the thumb, C, pre-HVT, and D, post-HVT. The objective of the study by Sparks et al., 2013, was to use MRI, based on blood oxygen levels to determine if supraspinal activation, in response to mechanical noxious stimuli, changed before and after the thoracic spine manipulation. This study provides preliminary evidence that suggests that supraspinal mechanisms may be associated with thoracic thrust manipulation and hypoalgesia. According to the study by Shadiak et al., 2018, osteopathic treatment significantly alters gastric myelectric activity and reduces the rate of change in the frequency response within the normal frequency range of 2 to 4 cycles per minute, indicating a physiological effect. The study by Perry et al., 2015, shows that treatments resulted in a sympatho-excitatory response during the intervention period with the manipulation technique, having a 255% increase. The results support the sympatho-excitatory responses observed in the studies. Skin conductance responses may be a feasible proxy method of detecting dorsal horn sensitization and neuroplastic adaptations occurring in the presence of low back pain. The research done by Budgell, 2000, supports the concept that aberrant stimulation of spinal or paraspinal structures may lead to segmentally organized reflex responses of the autonomic nervous system, which in turn may alter visceral function. The paper by Sato, 1992, studies somatovisceral reflex responses in the cardiovascular organ, gastrointestinal tract, urinary bladder, and adrenal medulla, in anesthetized animals after eliminating emotional factors, following somatic sensory stimulations. Some responses have dominant sympathetic efferent involvement, whereas others have dominant parasympathetic efferent involvement. Some responses have propriospinal and segmental characteristics, while others have supraspinal and generalized characteristics in their reflex nature. These somatovisceral reflex responses may be functioning during spinal manipulative therapy, in conscious humans. Diagram shows the central pathways of the reflexes, induced by myelinated somatic afferents. Diagram B shows the pathways of unmyelinated afferents. The thickness of the different pathways is an indicator of their strength. Excitatory or inhibitory effects are represented by a plus or minus sign. The size of the signs gives an approximate indication of the strength of the excitatory or inhibitory action. In this diagram, 1, 2, and 3 represent the simultaneous recording of intravesical pressure, parasympathetic pelvic efferent nerve activity, and sympathetic efferent activity of the hypogastric nerve, when stimulated for 30 seconds, with 1 representing the sample taking from an inactive bladder, and 2 and 3 representing samples taken from a full bladder. AD represent reflex changes in the maximum range of vesical pressure after pinching the skin, when the bladder is inactive. EH are histograms of perostimuli during strong rhythmic bladder contractions. The ordinates indicate the frequency of strong bladder contractions during a 30 seconds period. The areas of the skin that were pinched were the neck, A and D, the thorax, P and F, the abdomen, D and G, and the perineum, D and H. AF represent the gastric motility response samples. The bar and the dotted lines represent a 20 seconds period of pinching. This diagram shows the areas of the skin that have been pinched in relation to the reflex changes in gastric motility. G. Ventral view. H. Dorsal view. J. The model that illustrates the method used to assess the force of the reflex response. K. The clear circle indicates excitation. The filled circle indicates inhibition. The size of the circle indicates the extent of the excitation or inhibition. L. The effects of pinching the skin of the abdomen on gastric motility, sympathetic gastric efferent nerve activity, and parasympathetic vagal nerve activity. M. The effects of pinching the skin on the back leg on gastric motility, parasympathetic efferent nerve activity, and sympathetic stomach nerve activity. According to Kovanur Sampath et al., 2015, the autonomic nervous system and the hypothalamic-pituitary-adrenal axis have been shown to be dysfunctional in a number of chronic pain disorders. Spinal manipulation has the potential to be used as a tool in restoring the autonomic nervous system balance. Through its anatomical and physiological connections, the autonomic nervous system activity following a thoracic spinal manipulation may have an effect on the hypothalamic-pituitary-adrenal axis, and therefore pain and healing via modulation of endocrine and physiological processes. The effects of spinal manipulation on various functions of the sympathetic system have been identified by Budgell et al. 2001 and 2006. According to Picard, 2002, the physiological mechanism proposed for these changes to the neurovegetative system suggests a possible effect on segmental and extrasegmental reflexes, and on the peripheral sympathetic nervous system. Watanuki et al., 2001, and Sparks et al., 2013, in their imaging studies, showed the influence of spinal manipulation on supraspinal mechanisms. The study by Watanuki et al., 2001, looked at local brain activity immediately after a cervical spine manipulation. Whelan et al., 2002, Tuchin, 1998, Plaza Monzano et al., 2014, have concluded that the evidence supporting manipulation for endocrine functioning is contradictory, but it is reasonable to propose that somatic stimulation, thoracic thrust, can produce changes in the functioning of the hypothalamic-pituitary-adrenal axis, modulated via the sympathetic system. The study by Roy et al., 2010, showed that the effects of a lumbar spine manipulation appear noticeable by changes in paraspinal CT measurements at the level of L5. The results from the study by Carrison and Drysdale, 2003, support the hypothesis that spinal adjustments outside the region of the sympathetic outflow result in an increase in cutaneous blood flow. Conclusions. There are various studies showing that spinal manipulations with HVT can stimulate the sympathetic and parasympathetic systems, and therefore the visceral system and the organs. However, more scientific studies are needed in this area to better understand neurophysiological mechanisms. Here you can see a list of all the references used for this presentation. Thank you for listening.